What are you doing? Huh? What are you doing? Hey, what's up, guys? Philly Cuts here. Just kind of wanted to make a video because I guess, I don't know, I'm feeling pretty anxious, I guess. I've been going through some health problems lately, uh, physical problems. Like, well, I've sustained a couple pretty severe injuries over the past geez, it's been going on 10 months now. And it's been kind of like some pretty big trials and tribulations for me. I don't kind of want to make this a pity party or anything, but I guess I'm just kind of making this video because I'm, a little anxious, feeling a little worried about things. So, anyway, long story short, I have a operation tomorrow. They call it an operation because I have to be put under anesthesia, knocked out. I have to get what's called an MUA, manipulation under anesthesia for my knee. So back in May 28th, I got my surgery of total knee replacement. So here's my, doing this in director's view so you can see. So here's my scar on my right knee. I still got like a tiny scab up on top there. But back in May 28th, I got my surgery for total knee replacement. And my knee was pretty mangled. And it really probably was as a result of, I feel, of the job I was doing. I decided to leave social work, which I now kind of regret a little bit, and work for the U.S. Post Office. And I became a letter carrier, and I was what was known as a CCA for the past couple of years. It's called a city carrier assistant, where you're not like fully officially a postal carrier yet. Like in a lot of areas of the country, you kind of have to go through this process for a couple years, where it's kind of like you're a second tier employee. You don't get all your full benefits yet that you would be awarded as a full postal carrier. And the hours were just pretty crazy, man. Some hours, some weeks I was working, 55 hours. A few times I got 60 hours in a week, and just working like a ton of days in a row. I think the longest stretch I went was something like 16 days in a row I once worked before getting a day off. So it's just like a real archaic and messed up system. And I fell into that and really messed myself up. So not only did I have to get my knee replaced, but I also tore my Achilles tendon back in October. This might be hard to see. I can't really get an angle on it, but you could still see that there's kind of a lump here on my foot. And if I angle this right, you probably can see the incision. Sorry about this. But not only did I tear the Achilles and was walking on it for quite a while, but it also eventually became infected. And I'll probably make another video because I have all kinds of pictures, various pictures of what my Achilles looked like when it was infected. It got like a really bad abscess. Like, it was pretty nasty. It kind of looked like something that was out of like a science fiction movie. It was just huge and nasty. And uh, the progression of that, the infection, it got really severe over the course of like 2 days. And I ended up having to go to the emergency room, and had to stay in the hospital for like 3 days, to get the abscess drained and to just be on like huge mega doses of antibiotics because they were worried that I could get I can't even say it, sepsis or something like that, like an infection of the blood. So it was pretty bad. So while I was laid up with that, with the Achilles in October, my knee, which was hurting before that, like I developed like a limp in my gait, on my right knee, the knee that I had to get replaced. And I was probably working and walking on that for way too long. But anyway, because I was so immobile with the torn Achilles, like I had to wear a boot, and getting around the first couple months with that was pretty tough. I wasn't walking or moving too much because it was very hard to. I had to be on crutches. At first, I had to be on a walker with a boot. And then that turned into a walker and then crutches. It just wasn't a good scene. And what that did was that it kind of stiffened up the arthritis in my knee. So eventually, once the Achilles got cleared up and better, they looked at my knee. And I basically was in end stage arthritis in my knee, on the inner portion of my knee. This portion here, I think it's called the medial portion. I might be saying that wrong. But not only was it like end stage arthritis, but it was also necrosis of the bone in the knee. So my bone was basically starting to die on the upper portion of the leg here, on the inner side, the medial part. And I went through like a brief course of physical therapy, but when I saw the main doctor that I'm seeing for this now, he basically told me, your knee is trashed. There's not much we can do with it. I don't recommend scoping it. I don't recommend trying anything like that. I don't think a partial replacement would be good, because he said probably in like a couple years they're going to just end up having to do the other portion of the knee, and that would be a total knee replacement. So he recommended just right away going with a total knee replacement, which is what I ultimately opted for and decided to do. And like I said, I did that on the 28th, but it's been rough, man. I've been out of work on FMLA. So I've been, draining my savings and all that. And unfortunately with FMLA, you don't get any kind of payment or benefit. It's not like temporary disability, which I didn't have, unfortunately. You basically get your job saved on FMLA, and you get to keep your benefits, which is my insurance. But I don't even know when I'm going to ever be able to go back to being a postal carrier, to be honest, because the route that I was doing, where I worked out here in Western Mass, was pretty brutal, man. Like, I was walking some days on average anywhere from like 10 to 15 miles. Pretty crazy, dude. I never realized how rigorous the work is for a postal carrier until I started doing it, especially if you're in an area or a city where it's a lot of walking routes, where you're just parking at a point in a neighborhood and then you're walking around delivering mail, and you're just going up and down so many freaking flights of stairs and everything. And I'm older, I don't know what I was really thinking, to be honest. I think maybe I was having a midlife crisis or something, but I was just so burnt out with social work. And during COVID, social work was really, really rough. I had a huge caseload. My caseload ballooned. I had some clients die from COVID when I was going through this. And it just really burnt me out, and I decided to step away from the profession. But I think I'm probably going to end up going back, because I just don't think I can handle the rigors of, the physical rigors of carrying mail. I did like the job. It was not a big departure from what I was doing. You kind of are with yourself all day, which I didn't mind, and you can, listen to podcasts, listen to music, whatever, and, deliver the mail. But it just physically took a real toll on me, and I probably should have went to the doctor a lot sooner for my knee and for my Achilles. But I really did a number on myself. So anyway, back to the knee. I have to get this manipulation under anesthesia tomorrow because my knee is not bending enough. So your knee ideally should like straighten out to like 0 degrees, which I'm only getting, I think when I work it a little bit, I can get it down to like 4 degrees. But I think naturally my knees aren't perfectly straight because my other knees, my left knee is about the same. But for flexion, the bending part, you're supposed to get to ideally like 130, 135 degrees. And I'm only hitting about 100. If the physical therapist pushes on it, I can get to 105. That's like the best that we've gotten. But I've been stuck at that range for like, I've been stuck at that range now for about 3 or 4 weeks. So I saw the doctor, I don't know, about a couple weeks ago, 2 weeks ago, and then he recommended doing this. So it could be that my body is just producing a lot of scar tissue, and that's hindering my leg from flexing. So literally, I'm just going to be knocked out under. They're going to take my knee. See, here's an illustration. So I'm up like this. I can bend this knee down like this, right? I can't go anywhere near what this knee goes. You see that? This is stuck, and I'm freaking pushing it, dude. And I can't get anywhere near what this one does. So they're literally, they're going to knock me out tomorrow on anesthesia and just physically push and manipulate and work my knee into flexion. And hopefully, I'm hoping that's what it is. I'm a little weirded out by everything because they only took like a couple x-rays when I visited the doctor the first time out of my surgery. It actually was a PA I visited for my first session out of the surgery. That was about 2 weeks after. They took a couple x-rays. They said everything was fine. But then when I saw the doctor a few weeks ago, or 2 or 3 weeks ago after that date, he didn't take any x-rays or anything. He just kind of looked at my leg and said, you need to get this MUA. And he's also going to give me cortisone when he does that too, which he says isn't necessarily the norm. But he said that he's found success with doing that. He's found success with doing that when he's done this MUA. And he hasn't really done too many of them. He said that I'm kind of like in a, I don't know if I want to say unusual cohort involving this, but not common cohort where I have to get an MUA done. So I'm just feeling a little nervous because I'm a little scared that if the MUA doesn't work well, like I don't even know what the next step would be. I think you can try to do another MUA. And then if that doesn't work, they might have to open you up again and physically remove scar tissue. So it's like, I'm just kind of nervous about what if this, I'm having like a lot of what if thinking and anxiety about it. I'm trying to not think about that too much because it's not really in my control, really. I've done everything that they've told me to do with PT. I did it every day, multiple times a day. I've been riding a stationary bike daily, twice daily. I'm now up to 15 minutes each time. And the knee hurts and it feels pretty unpleasant. But I continue to kind of push with it. But it's it's just not getting the knee to bend more. So kind of sucks. You need your knee to flex to at least 110 to be able to go downstairs pretty well. So going downstairs for me is really difficult right now. Going up is easier. I mean, it's not the best. I can go upstairs pretty good, but going downstairs, it's pretty rough. It hurts. I have to do it very slowly, and I feel like sometimes I'm gonna fall. If I'm pretty warmed up from doing PT, like if I've done my bike and a bunch of other exercises, I can go up and down stairs a little bit easier. Like I can do reps of 10 doing that. But it's rough. So not ideal, you know. So I'm just a little nervous about all that, and I don't know. I'm just feeling depressed, man. I never knew at this age that I would be in this condition. You know, I've always been. I mean, I'm not in the best shape or anything, but I've always been pretty physical. You know, I've done physical jobs throughout my life. You know, I was once a bartender. I was once a waiter. I worked in retail, and I guess I just think maybe all that work put me over the edge. I don't know. Certainly the post office did. I mean, it just unbelievable the amount of labor that you have to do for that. I don't even know. I'm so mad at myself for even putting myself through that. Like, I don't know what the hell. What the hell was wrong with me to keep pushing through the pain, because I was in pain for months, man, doing that job, and I was just popping acetaminophen or Advil. You know, I was taking a lot of that every day, way too much. I never was on any like real hardcore painkillers, nothing like benzos or anything like that, or Oxycontin, anything like that. But you know, it's taken way more of certain stuff than I should have been, and so now I got to do this tomorrow. Scheduled to do it at 11:30 in the morning. I'm going through the Cooley Dickinson hospital system here in Western Mass, and I just hope it works out. You know. I've been trying to put things into perspective, you know, watching other people who have gone through this and who maybe have had it worse than me. Seen people who've had it better than me, and that's dangerous too, because it's not good to compare yourself to others. You know, everybody's body is different. Everybody heals at a different rate. You know, some people are lucky and within a month they're doing pretty good and they're getting like 120, 130 flexion, you know. But I guess I'm in that, like, I think it's something like 10 or 15% of knee replacement goers end up having these issues with flexion, you know. The original issue that I was having with the knee was getting it straight. Like, I couldn't get the knee very straight. Like, at one point, I couldn't get it straighter than 30 degrees. And it was, you know, causing me to walk funny and maybe keep my body hunched over. I guess I'm lucky I didn't really screw up my hips or anything like that either. So I just I'm trying to see the positives in this, you know, trying to take care of myself better. When I get the go ahead to go to the gym again, lift weights and stuff, upper body, because I haven't gotten that clearance yet. I'm going to do that, get back into shape, and look for a new job, I think. I'm going to have no choice, but this thing's ravaged me physically and financially, professionally, I guess you would say. Just my life has been like on a standstill for months, you know. And I've been trying to post videos, but I don't know. I've just been so depressed about it, and I guess it's just something I have to do. You know, I've been wanting to post a video of this just to talk about it, I guess, to maybe try to find some community in the total knee replacement community, just to maybe not feel alone, you know. But I'm just hoping that this works out, you know. I might maybe make some other videos just about my recovery, how it went with my knee, how that's been going. You know, like the first couple weeks, I could maybe show people how to prep for it and everything, like good things to have in your house for it. Because your life really does change when you get the knee replacement at first. Like all the things that you would take for granted, you can't really do the first couple weeks. You know, like cook your own food or go out and drive. Like it took a month before I was able to drive because you're on Oxycontin for, well, I was on Oxycontin probably for about 5 or 6 weeks to help with the pain management. Now I'm just taking, you know, Tylenol for that, acetaminophen. So, I don't know. I guess I'll keep you guys posted and let you know how it goes tomorrow. So I'm going to have to go there at 11:30, get that done, and then hopefully they want me to attend physical therapy that same day. So I have a physical therapy appointment at 3:30, and I'm going to have to go like every day to physical therapy, you know, during the week. So I'm going to have to go like 10 times in 2 weeks. And I just hope it works, man. I'm going to try as hard as I can. You know, I have been, that's what's frustrating is that, you know, you are pushing yourself and you're doing everything that they tell you to do. And it's just like, it just feels like something's like stuck in your knee, man. Like it's just like it just won't budge. And no matter how hard I push, and then it, you know, if you push super hard, it gets really, really painful, and then it gets inflamed and swollen, and then you're pushed back doing things because of that. So it's like a vicious cycle, kind of. But anyway, I hope you guys are doing well. And I don't know. I guess I'll talk to you soon, all right? I'll let you know how it goes tomorrow. I'll try to put up a video after the procedure and let you guys know what the doctor said and stuff like that. All right, man. Have a good night, guys. Peace.